Let's talk about gonorrhea. It's one of the most common STIs out there, but for a lot of people, it's kind of shrouded in mystery or, just silence. So today, we're going to change that. We are going to break down exactly what it is, how it spreads, and most importantly, give you the essential info you need to stay healthy. So just how common are we talking about? Well, let's start with this number, 1.5 million. That's the estimated number of new gonorrhea infections in the United States every single year. That's a huge number, right? And it's exactly why getting the facts straight on this is so important.
All right, here's our game plan. First, we're going to define what this infection actually is. Then, we'll get into the symptoms, both the ones you can see and, more importantly, the ones you can't. After that, we'll cover the serious risks, how it's diagnosed and treated, and we'll wrap up with the most critical piece of the puzzle, prevention.
Okay, first things first. Let's get right down to the basics. What are we actually talking about when we say gonorrhea? So at its heart, gonorrhea is a bacterial infection. It's caused by this specific bacteria with a very long name, Neisseria gonorrhea. And this little guy, it loves to live in the warm, moist areas of the body. That's why it typically sets up shop in places like the urethra, the cervix, the rectum, or even the throat. So how does it get around? Well, it's spread almost exclusively through sexual contact. That's vaginal, oral, or anal. And listen, it is highly infectious. To give you an idea, the risk of it being passed from an infected woman to a man in just a single encounter is around 22%. That's a pretty high chance. It can also be passed from a mother to her baby during birth, which can lead to really serious issues for the newborn. Okay, let's move on to one of the trickiest parts of understanding gonorrhea, the symptoms. Because what you see, or more often what you don't see, is really the key to why this thing spreads so easily. Now, if symptoms show up, and that's a big if, they usually appear within about 2 to 14 days. For men, it might be things like painful urination or a discharge. For women, it can be pretty similar: discomfort, maybe some pain, or an unusual discharge. But here's the kicker. Even when these symptoms do show up, they can be so mild that you might just brush them off. And this brings us to the single most important thing you need to know about this. The vast majority of people with gonorrhea have absolutely no symptoms. None. Zero. You can feel perfectly healthy, completely fine, and still have the infection and be able to pass it on to someone else. And that is the real reason it's so common. Because it's often so silent, it can be really tempting to think, well, what's the big deal? But an untreated infection can cause some major long-term health problems. Let's take a look at what those are. For women, the stakes are especially high. If it's left alone, the infection can actually travel upwards into the reproductive system. This can cause something called pelvic inflammatory disease, or PID for short. And PID is serious stuff. It can lead to permanent scarring, chronic pain, and even cause infertility down the road. And in some rare cases, the infection can go, rogue. It can actually get into the bloodstream and spread through the whole body. This is called disseminated gonococcal infection, or DGI. It can cause fevers, rashes, and a really painful type of arthritis when the bacteria settles into your joints. Now, there's one more critical fact we have to state, and we need to be very direct here. If a young child who is past the newborn stage is diagnosed with gonorrhea, it is almost always considered a sign of sexual abuse, and it has to be investigated. Okay, after all that heavy information, let's switch gears to the good news. And it is really good news. Gonorrhea is actually pretty easy to diagnose, and right now, it's completely curable. So, how do you find out if you have it? It's incredibly simple. Doctors use this super accurate test, a NAT test, that basically looks for the bacteria's DNA. All it takes is a simple urine sample or a quick swab. It's fast, it's painless, and it's extremely reliable. And getting cured is just as straightforward. Once you're diagnosed, treatment is typically just a single shot of an antibiotic. But, and this is important, the process doesn't stop there. You have to avoid any sexual activity until the treatment is done. And you absolutely need to tell any partners you've had in the last 2 months so they can get tested. That's how we break the chain. But there is a pretty big warning sign we all need to be paying attention to. This bacteria is clever, it's adaptable, and resistance to the antibiotics we use to treat it is becoming a real problem. This is a massive public health threat, and it means that preventing the infection in the first place is more important than ever. Which leads us perfectly into our final and honestly our most important section. With treatment getting trickier, our best weapon, our cornerstone for staying healthy, is prevention. So what does prevention actually look like in real life?
Well, your best defense is the fundamentals of safer sex. We're talking about using condoms every time. It could mean reducing your number of partners or being in a mutually monogamous relationship where you've both been tested. And like we just said, getting diagnosed and treated fast is also a form of prevention. It stops you from passing it on.
And because this infection is so often silent, getting screened regularly is a total game changer for certain groups. The CDC has some very clear guidelines on this. They recommend yearly screening for sexually active women under 25 and for men who have sex with men. They also advise it for pregnant people and anyone else with risk factors, like having a new partner. It's really worth a look to see if these guidelines apply to you.
You know, when you boil it all down, so much of this comes back to one simple thing: communication. Talking to your partners about getting tested isn't awkward. It's a sign of respect for each other. And just as important, talk to your doctor. Don't ever be afraid to ask for the tests you need. You have to be the biggest advocate for your own health. So, we'll end on this thought. We've covered what gonorrhea is, its sneaky, silent nature, the real risks, and the clear steps for treatment and prevention. You have the facts now. So the only question left is, knowing all this, what's one step you can take, starting today, to protect your own sexual health?